Hi, everybody. My name is Jeremy Menchik. I'm an associate professor in the Pardee School of Global Studies, political scientist by training. I'm going to be talking about a big research project that Gianluca and a number of other scholars across BU are involved with that's related to health misinformation and social movements. Next slide, please. So in April 2020, when, as all of you remember, the world kind of came to a screeching halt, in other parts of the country, there was a lot of activity gearing up. Protests started in Idaho, Michigan, Wyoming, Ohio, against mandatory school closures, business shutdowns, all these COVID-related restrictions that were meant to stop the spread of the virus. The protesters were mixed. It was a combination of left-wing libertarians, right-wing libertarians, some soccer moms, but pretty uniformly opposed to restrictions on liberty. They also had the backing of some prominent Tea Party related organizations. You can see here on the slide a guide for the reopen movement, as some people came to call it. And the Tea Party organizations were helping to coordinate slogans and tactics around the country. They also created upwards of 700 different Facebook groups to help mobilize a social movement to protest against COVID-19 related policies. In total, the movement grew to about 2.5 million people, and thus was born the COVID-19 protest movement. Now, as a social scientist, it's not very often that we get to watch a protest movement be born. And so I saw this as something of an opportunity. So I put together a team of researchers, including an undergraduate ethnographer, a couple computer scientists, an economist, political scientists, really actually spoke to the depth of BU's strength in research, multidisciplinary field, in order to try to study the origins, development, evolution, and the impact of this mass social movements. We wound up, in addition to the ethnography, scraping hundreds of Facebook pages for comments and posts over about a year, and used a whole slew of methods from panel data and statistical analysis to computational linguistics in order to explain the origins and evolution of this massive social movement. Next slide, please. So you can see here, this is a topic model with a show of the evolution of topic discourse over the course of the movement. The movement initially focused on economic concerns, the really devastating impact of the shutdowns on the economy. As you can probably recall, it was the largest single loss of jobs in US recorded history. And that's what the movement initially focused on. But about a month into the movement, health misinformation absolutely flooded and swamped the Facebook pages. The first real major node for misinformation was a Plandemic video. Plandemic video argued that a cheap and widely available treatment for COVID-19, hydrochloroquine, was being made unavailable because Big Pharma and Anthony Fauci in particular wanted to patent the vaccines in order to make money and prevent cheap and widely available treatments being used. So you can see here that the hardcore conspiracy content, what I mean by hardcore is COVID is faked, it's a communist conspiracy, it's a China hoax. That was about 5 to 7% of the topic discussed in this massive movement over the course of about a year. If we were a little bit, if we relaxed the criteria for what kind of misinformation, we included misinformation about masks, misincluded information about lockdowns, the result would be much higher, more like 15 or 20% of content. Next slide, please. Over time, conspiracy-related content increased, peaking in November with the 2020 US presidential election, which was widely viewed within the Facebook groups as fraudulent, with the election stolen from President Trump by President Biden. And members of the movement protested, particularly in Michigan, in Arizona, and in January, some prominent leaders of the movement attended the January 6th protests in Washington, DC, including getting arrested at the US Capitol. So you can see here the composition of conspiracy-related discussion by month, peaking in November 2020. Next slide. So this is a comparison of the topic from the first 3 months of the movement to the last 3 months of the movement. And at the 1 year point, there's less conspiracy content than at the beginning. So in that sense, it's, it's kind of good news. But again, that's kind of a narrow view. And I want to end with a more pessimistic view. This is a movement that started for economic reasons. It started for political reasons. But over time, became filled with health misinformation, political misinformation, and all sorts of other conspiracy theories. So what we learn about health misinformation and social movements from this particular research agenda is very bad news, because it means that it's not an isolated problem that can be solved by shutting down a few bad websites or a few bad Facebook groups. It's endemic to a massive social movement around the US and around the globe with misinformation on a wide range of issues. And it makes it a much harder problem to solve. Thank you very much for listening. I look forward to your questions.